My topic for this week is cholecystitis, and cholecystitis is basically an inflammation of the gallbladder. And what causes this is a gallstone that blocks the tubing that leads into the gallbladder, and this results in a bile buildup in the gallbladder. And another reason it can be because of bile duct problems, tumors, serious illness, and certain infections. And here you can see the blockage of the bile duct because of this gallstone. Alright, some signs and symptoms that we need to be aware of is severe pain in the upper right and center abdominal, pain that spreads to the right shoulders and back, and tenderness over the abdominal when it is palpated, and also nausea, vomiting, and fever is very common. Complications that can occur is infection of the gallbladder, which is basically an infection of the bile inside the gallbladder, and death of the gallbladder tissues. This is the most common complications when it comes to this complication, and this can essentially lead to the gallbladder being torn. Some preventions and that the patients can be aware of to reduce the risk of having a cholecystitis is weight loss. If the patient is losing weight, they need to lose weight very slowly, because rapid weight loss can increase the risk of gallstones. So we need to teach the patients to aim to lose 1 or 2 pounds per week. And obviously maintain a healthy diet, and teach the patient to choose a healthy diet and maintain a healthy weight. Some diagnoses that are out there are blood tests. A doctor may order blood tests to be done to see the signs of infection and signs of gallbladder complications. There's also imaging tests, and that shows the gallbladder, and this can be done through an abdominal ultrasound or a CT scan that is used to see the image of the gallbladder to reveal the signs of cholecystitis. And there's a scan that shows the movement of the gallbladder, of the bile actually, through the body. So this is done through a HIDA scan, which involves injecting a radioactive dye into the body, and it attaches to the bile producing cells, so that it can be seen as it travels with the bile through the bile ducts. So it's pretty cool. And treatments, it usually involves a hospital stay that to control the inflammation of the gallbladder, and sometimes it can lead to surgery. Surgery is necessary sometimes. At the hospital, the doctor will work to control the signs and symptoms, and this is done through fasting, through fluids and the IV. The doctor may also order antibiotics if there's a bile infection, pain management, and also procedure to remove the stone itself or the gallbladder. So the procedure that is done to remove the gallbladder is called cholecystectomy, and the signs are likely to decrease in 2 to 3 days. However, gallbladder infection, if the gallbladder is not removed, often returns. So most people with the condition eventually do need to get that gallbladder removed. And just some nursing interventions that we need to consider is that we need to monitor the patient's INO. making sure that they're not secreting a lot of potassium. And we need to monitor for signs and symptoms of the condition, and monitor for the nausea, vomiting, abdominal cramps, and assess for bleeding, and also apply suctioning if necessary because of the vomiting.